views expressed on this program are those of the hosts, guests, and callers, and are not necessarily those of this station, its management, or other advertisers. You're listening to Transformation Talk Radio.
Get ready for a game changer. Sarah Westall is bringing you Business Game Changers Radio. Mondays at noon Pacific, 3 Eastern, Sarah will bring you leading experts, visionaries, and newsmakers who provide the best commentary on big issues and cutting-edge innovations. Sarah's 20 years as a business executive will help you think like an entrepreneur with expertise, energy, and attitude. Now here's your host, Sarah Westall.
Welcome to Business Game Changers. I'm Sarah Westall, and you're listening to Conscious Business Radio on the Transformation Talk Radio Network. Today, we are going to be talking about the Affordable Care Act, or as everyone likes to call it, Obamacare. You all know that the premiums are having huge increases all across the board, and everyone is being affected by this. We are going to be seeing, on average, a 23.9% increase in 2017, and this is based on independent analysis by Charles Gaba, and I have the information on my website. He went and analyzed every plan and what they published and what these increases are going to be, and that's the true increase at this point. They're claiming that's only 4%, but that's just not true. And anybody who's looking at the potential premiums for 2017, they know what I'm saying is accurate. And when people's salaries have only increased by 3% on average over the last 4 years, it's just not something that can be sustainable by any measure. The system just can't handle it. So I took a look at my home state, which is the state of Minnesota. I wanted to see really what the increases have been since 2014. Because, Trump was nailed in the last debate when he was saying that the increases are going to be 65, 70% increases. Fact checker and Hillary Clinton and company all said that he was way exaggerating. But I don't think so. When you look at from 2014 to 2017, he was actually understating what the increase has really been. Just looking at Minnesota, from 2014 to 2015, we had a 23% increase. From 2015 to 2016, we had a 28.7% increase. And then going into 2017, they're projecting 57.3% increase. So now if you look at the compounded interest, that's 149% increase from 2014. And most states in our union are suffering with triple-digit increases over the last 3 years as well. So to state that a 65%, 70% increase is exaggerated, maybe it's higher than it is for a 1-year increase, but when you start looking at a 3-year trend, it is understated. And with 3% salary increases, people just can't afford this. Now, let's be certain about all this. People aren't absorbing these increases. They're downgrading their plans, they're increasing their deductibles, or the healthy and the young are dropping insurance altogether and paying that penalty. But now you look at the other side of it, and proponents of the Affordable Care Act are claiming that 13 million more people do have insurance than they had before. And that is a really good thing. But when 38% of middle-income people are delaying medical treatments altogether because they can't afford deductibles and co-payments, then you start to wonder, now we have 13 million people more with insurance, but when 38% of the people are not using their insurance because they can't afford it, are we really increasing insurance for people? And as premiums keep continuing to rise, people are going to choose higher and higher deductibles, and that just to keep it in the affordable range for catastrophic situations, they're just going to keep delaying their treatments. The more serious problems, people are even delaying more, research has found. And this is according to Gallup. The other side of the healthcare debate that people often overlook is the incredible stress that doctors are experiencing. Many doctors are being forced to see upwards of 12 patients per hour to keep their costs down. They are also expected to monitor spending and are constantly being challenged by insurance companies to keep treatment expenses to a minimum. They have over 10 years of medical training and are being told what they can and cannot give to their patients by insurers who have not seen the patient and who more than likely have zero medical training. This is incredibly frustrating for doctors and for patients who end up not getting the medical care they need. So I have a very special guest. Her name is Twila Braze. She's the founder of Citizens Council for Health Freedom. She's coming on to talk to us about what her organization is doing to bring freedom to citizens and to give doctors more control over the patient-doctor relationship so that they have the ability to give their patients the health care that they need. She's a really interesting person. She was recently named as one of the 100 most powerful people in healthcare by Modern Healthcare magazine. And she is working with doctors and clinics to create the Wedge. The Wedge is a group of clinics and doctors who have decided to abandon all the government contracts and the managed care providers, the HMOs and the health insurance providers, and do it on their own. Straight patients to clinics. And they have over 125 clinics that are signed up for this all over the country. What they're finding is that the clinics that are abandoning the government and the health insurers are able to provide services that 60, 70, even 90% lower than what they were offered before. And they're finding that they're making up to 60% more profit doing that. So everyone is winning. And the patients are happier. The doctors are happier. It's kind of an amazing thing when freedom takes hold and people are allowed to do what they're trained to do. So I am very happy to welcome Twila Braze to the program. Hi, Twila. Welcome to the program.
Thanks so much, Sarah. I'm glad you invited me.
Well, I've been wanting to talk about Obamacare for a long time, and you have a very creative thing going on that really could help a lot of people. And so I could talk about Obamacare like I wanted to and talk about something that could really make a difference for people. But let's get into the problems with Obamacare before we get into the solutions. Obamacare's health insurance costs have absolutely skyrocketed. People are freaking out, including me, when you look at what your new health care bill is, right? It's really have gone up quite a bit. People who do not qualify for subsidies are paying 50 to 100% more for insurance. And in many cases, it's more than their mortgage payment. Why has this occurred?
So there are several reasons. It's all mostly has to do with the law and how the law was structured. And if you recall, the law initially said that, well, the law still says that all of us have to be insured. All of us have to purchase or get some health coverage of some sort. But of course, the Supreme Court ruled that we do not and are not required to purchase insurance, that would be unconstitutional. On the other hand, the Supreme Court said, but if they don't, then you can fine them, but you can't fine them enough to force them to purchase health insurance. So it can never be onerous, so onerous that they are forced to purchase health insurance. And so the fine has to stay relatively small. And therefore, all sorts of folks, particularly the young and the healthy, who know that they, like maybe last year, they never ever even visited a doctor. Maybe they haven't this year. Maybe they haven't gone to a doctor for 5 years. And they look at the cost of those premiums and they say, this is not a very good deal for me. And so I am not going to get coverage. The law was based on the fact, and it was structured in such a way that they require everyone in the country to be covered so that all the money from everyone in the country comes in to feed the system. And that isn't what happened. So that's one reason. Another reason is that all the sick and the older have now come into the Obamacare exchanges. Now, the Obamacare exchanges are by themselves very expensive even to create, to run, to manage. They're very expensive for the state. They're very expensive for the federal government.
The overhead is expensive.
The overhead is expensive. That's right.
Before you even get into any care.
That's right. So it's this huge technological superstructure that has to be maintained. There's all these lines of code. They have to be connected between the states and the federal government. I mean, it costs millions and millions and millions of dollars to even create it. I'm not even sure that they have figured out totally the back office operations. They were not finished for the last 2 years. They may or may not be close because it's so complex and it's so expensive. And so, but hardly anyone is using it compared to what they thought people would use it, which means all of these costs are then put on a smaller number of people, so that that increases the premiums, because there's a part of your premium that is taken out to pay for this superstructure.
Well, everybody's looking for alternatives because it's so expensive.
That's right. And another reason it's really expensive is because the companies that are left, a lot of the companies are starting to leave the exchanges because they've lost so much money. And that's because all the young and the healthy haven't come in. And it's also because the employers didn't switch to the exchanges. They really thought that the employers would switch all sorts of their employees into the exchanges, and most employers have chosen not to do that. And the whole structure, again, the whole financial structure.
And why did they choose not to do it? Because the cost was more expensive? I mean, because it's always money with them, right? With employers.
It's money, but it's also satisfaction. They do want to keep their employees. So if you look what's available on the exchange, they may have decided they don't want to force their employees into whatever.
Because it wasn't a cost savings. Why switch over when it's the same price or more and it's not as good?
That's right. In addition to that, if you are a self-funded company, you can offer an Obamacare compliant policy, but you can also offer bare bones policies, which for the company make a whole lot more sense, but they also make a lot more sense for a lot of the young and healthy workforce who only want something to be there more generally, not a big catastrophic policy because they can't afford the catastrophic policy, but they want some sort of a policy. So I think there's a variety of reasons that employers said, no, we're not moving to the exchange. So one of the big reasons that the prices are where they are now is for the insurers who have decided to stick with the exchange. They are raising their prices so high because the government, through Obamacare, said we are going to, for the first 3 years of Obamacare, we are going to refund you all your losses. We're going to reimburse you all your losses.
Oh, geez. I didn't know they were doing that.
Oh, yeah. There's 3 programs, often called the 3R, but it's like this 3-tier program of redistribution, reinsurance, risk adjustment, and risk corridors. And 2 of those are supposed to be gone at the end of this year. And they are failing to fulfill their promises. So, for instance, one of them, reinsurance, was supposed to take care from all the health plans and give it to risk corridors was supposed to take money from all of the health plans that had a really good year, right? Their expenses were lower. Yep. And give it to all the health plans that had a really bad year. Their expenses were higher. But the fact of the matter is that there weren't hardly any plans where the expenses were lower and all covered. So,
well, it's because the sick people are the only ones in there pretty much.
That's right. So the plans asked for something like $2.9 billion to be reimbursed. But the money that the government got from the so-called plans that had a good year was just short of $400 million.
Oh, geez.
So in other words, the federal government only paid, I think it was 12.8% of the claims that came in from all these insurers. So that's why you see these insurers saying, we've lost $500 million. We've lost $300 million. And now some of them have started to sue the government for that money.
Okay, so now if they're going to raise all those rates up, then all it's going to do is be more of an exodus out of that by people who are maybe not even that little bit sick. I mean, anybody who would save the government money are going to leave those exchanges.
That's right. Because it doesn't make any sense. Somebody just emailed me recently and said, or maybe it was a tweet, I can't quite remember, but basically said, I'm going to buy a new car or a used car instead. Because some people are paying, $12,000 a year, and then they never go to the doctor. And if they do go to the doctor, their deductible is $6,000. So they're paying for it out of their pocket anyway. So none of this makes sense to them to spend, let's just say $12,000, or even if it's a $6,000 policy or $7,000 policy, you could get a pretty good